As we get older, most of us expect to have some health issues, but we may not realize how the changes we face, things like not being able to drive anymore, the fear of falling, or losing a spouse, can influence our overall health. That's why it's important to talk to your healthcare provider about these things. Jim's story is a good example of what can happen when such life changes occur.
I've been a diabetic for several years, so I know how important it is to take my meds, watch my diet, and exercise. And I was doing okay. But after my wife passed away, I started feeling pretty down and I stopped paying attention to my health. Brenda and I would walk every night after dinner, but I just didn't enjoy walking alone. And she was such a good cook, I never had any reason to learn. One morning, I started making breakfast. Can you believe I set off the smoke detector making a piece of toast? But at least I was taking my meds every day. That is, until I got the flu. The flu hit me like a ton of bricks. I wasn't eating and drinking, and I got really weak. To make things worse, I didn't pick up my diabetes medications. I had no idea how quickly my health could slip away. After 3 days, I got my neighbor to drive me to the doctor. The flu is what got me in to see my doctor. But he was more concerned about the other things that were affecting my health. My bad eating habits, no exercise, my blue mood. He told me to call the Elder Helpline. The next day I called 1-800-96-ELDER and spoke to Francine, an Elder Helpline specialist. I explained that my doctor told me to find out about a diabetes class. As it turns out, there was one starting up pretty close to my own home. Then I told Francine that I was so sick with the flu I couldn't pick up my diabetes meds. So she referred me to a pharmacy that provides home-delivered prescriptions. Why didn't I think of that? Then she told me about their Shine Medicare counseling program. She explained that Shine could help me figure out if my insurance would cover mail-order prescription service. And based upon my fixed income, I might be eligible for some special Medicare programs to help cover my out-of-pocket costs. She scheduled a Shine counselor to call me the next day. When she asked me about my grocery situation, I admitted to her that my cupboards were pretty bare. So she connected me with a local nonprofit that provides home-delivered meals to seniors. And guess what? They even have meals just for diabetics like me. I had no idea there were so many services out there to make my life a little easier and a lot better. Thanks to my doctor's advice and the referrals I got from the Elder Helpline, I am taking the right steps to get my diabetes back in check and feeling like my old self again. I'm saving money on my prescriptions, and I even met some new friends at my diabetes class. If I ever run into trouble like that again, I know who to call.
Now, meet Patricia, who is going through some difficult financial times, which was affecting her health in many ways. At first, she was reluctant to share her situation with her doctor, but she finally decided things were getting too serious to hide any longer.
My arthritis was giving me a lot of trouble, so much so it was too painful for me to drive anymore. One day I almost fell in the grocery store. I wasn't hurt, just embarrassed, but it really scared me. I started using a cane, but to be perfectly honest, I was very afraid about falling and getting hurt. I started going out less and less. And I was embarrassed about my home because I couldn't clean it the way I used to. Another reason I was in so much pain was because I wasn't taking my arthritis medicine the way I was supposed to. You see, I'm on a fixed income, and the medicine was so expensive that I cut the pills in half to make it last longer. But it really wasn't helping with the pain anymore. I finally broke down and told my doctor what was going on. She listened to my story and told me to call the Elder Helpline. She said, talk to them about everything, about my arthritis, the expensive medication, my fear of falling, and about my financial problems. I thought my situation was hopeless, but I was wrong. I called 1-800-96-ELDER and talked to the Elder Helpline specialist, Denise. She patiently listened and then asked me some questions about my income. She told me there were a few programs that could probably help me, but I was going to have to do some paperwork and be a little patient. No problem, I told her. I've got the time. She explained I could apply for the SNAP program, which would help with paying for my groceries. I don't have a computer, so I couldn't do the application online. She sent me the application on paper so I could do it myself. She also told me there were some other programs I could apply for. I might be put on a waiting list for a while, but because of my age and how bad my arthritis is, there's a good chance I will get some help cleaning my house and even getting home-delivered meals. Then she had me talk to one of their Shine Medicare counselors. He told me I could apply for 2 special Medicare programs that could help cover the cost of my arthritis medication and my copays. Well, as it turns out, I was eligible. Now the cost of my arthritis medicine is totally covered. No more cutting those pills in half. Oh, and one more thing. Denise told me about some free health and wellness classes I should think about. One for managing my arthritis and one to prevent falls. So I signed up for both. Between the classes and taking my medicine the way I'm supposed to, I am feeling so much better, and I'm not so afraid of falling. Obviously, I am very happy I called the Elder Helpline.
Now you know why it's so important to talk to your healthcare professional about any changes in your health, as well as those personal circumstances that can impact your health. So, be sure to keep us up to date on any changes in your life. And remember, your healthcare providers are here to help you get healthy and stay healthy.